Okay, let's give the floor other participants of our meeting, and I invite the rep of Saudi Arabia to tell some words, please.
Dear
colleagues from Saudi Arabia, are you here?
Do you hear me?
Okay, so I give the floor. Oleg Olegovich, are you here?
Yes, Olga Sergeyevna, do you hear me? Olga Sergeyevna,
Yes, Oleg Olegovich is
do you have
here.
a chance to hear
Please.
me? Honorable colleagues,
Oleg Olegovich, we don't hear you.
Dear colleagues, do you hear me?
Yes.
Excellent.
Yeah.
Thank you again. Thank you, Olga Sergeyevna, for your time, and sorry for inconveniences we had due to technical reasons.
Oleg Olegovich, no sound.
But Olga Sergeyevna, I heard the colleagues from other delegations heard me, if I'm not mistaken. So could you please nod if you hear me? Yeah, I see.
Yes, Oleg Olegovich. Yes, Olegovich, we hear you well and see you too.
Perfectly. So sorry again, colleagues, for the inconvenience due to technical reasons. So first and foremost, on behalf of the Ministry of Health of the Russian Federation, let me welcome you all today on this meeting. It is my honor and privilege to welcome you. For the past 15 years, the Bricks countries have enjoyed a relationship rooted in equality, mutual respect, and trust. Each country brings wealth of experience in public health. Clearly, sharing these insights can pinpoint successful strategies and methods. Research has the potential to uncover new treatment and preventive methods for a range of disease, including both communicable and non-communicable disease. Consolidation of joint efforts to preserve health throughout the entire human life cycle should be the basis for the BRICS countries' cooperation strategy in the field of healthcare. We understand the scale of the tasks that we have to solve. I have no doubt of success, but we must use our potential to make the work of a physician as effective as possible, of public health specialists as effective as possible, and provide them with technology, knowledge, and know-hows, and provide the patient with high quality and affordable medical care. The Russian Federation, as you know, and thank you again for joining us today, has proposed to create a standing expert platform to bring these shared ambitions to life. Setting up the BRICS Public Health Research Network will enable member states to undertake joint research projects and exchange expertise in various public health domains at both technical and policy level. Collaborating in public health not only strengthens diplomatic ties and professional ties, but also pave the way for other forms of collaboration. Successful cooperation projects and research are likely to draw investment in the healthcare sector and other countries and organizations. In conclusion, I would like to wish you again fruitful discussions and successful work of this public health research network. Thank you again, colleagues. Thank you for joining us.
Thank you, Dr. Salagai. And now we will hear opening remarks from the other member states. I kindly ask each speaker to limit their remarks to 2 minutes. And I invite the rep from South Africa, please.
Good afternoon, Chair, dear colleagues. My name is Andy Pengu and I am from the Ministry of Foreign Affairs of South Africa. I am waiting for my colleagues from the Ministry of Health to log in, but just to not to delay the process, I just wish to thank the Chair for organizing this meeting. As it may be clear to many of you, South Africa takes this meeting very seriously because we have had lots of collaboration with many of the Bricks countries, the old as well as the new countries. Since like at the level of the UN and within BRICS. So we are hoping that strengthening our collaboration in terms of the public health is something that will see our collaboration on the track taking greater heights, and we are looking forward to this meeting. Just to also just remind colleagues that we are having other meetings that are going to be convened by my president at the level of UNGA on health, including pandemics. So we are hoping that all these efforts can come together. But just to reiterate our support to the chair. Thank you.
Thank you very much to South Africa, and I invite the rep of United Arab Emirates, please.
Can you hear me?
Yes.
Thank you, Chair. Honorable Chair, esteemed colleagues, it is an honor to participate in this important gathering of BRICS experts. Our shared commitment to the public health and improving the well-being of society is a testament to the values that unite us. We look forward to productive discussions and identifying concrete actions that will allow us to move forward collectively. Thank you, Chair.
Thank you very much to United Arab Emirates, and I invite the rep of Brazil, please.
Good morning, good afternoon, good evening from Rio de Janeiro, Brazil.
Sure.
Are you hearing me?
Yes.
Okay, thanks. So again, good morning, good afternoon, good evening from Rio de Janeiro, Brazil. My name is Paulo Bus. I'm the director of the Center for International Relations in Health at the Oswaldo Cruz Foundation, acronym CRIS Fiocruz. I am Professor Emeritus of the Oswaldo Cruz Foundation, Fiocruz, full professor of its National School of Public Health, and Doctor in Medicine and then PhD in Public Health. The Oswaldo Cruz Foundation is the National Institute of Public Health of Brazil. It's an institution that is part of the Brazilian Ministry of Health and is the main public health research agency of the Ministry of Health. A little later, I will give a presentation of the institution as instructed by the program. I would like to thank you for the invitation to participate in this first BRICS experts meeting on public health representing Brazil. I warmly congratulate the Russian Federation and its well-known and respected Russian Research Institute of Health for this excellent initiative. Fiocruz, as I said, the acronym of our institute, declares its great interest in participating in this initiative. Would like to thank you for the concept note presented for this meeting. As everyone knows, Brazil will preside over BRICS in 2025. Therefore, according to the network's governance proposal, Fiocruz should play an important role in implementing the network next year, and we will be very happy to cooperate with all other networks member institutes to do that. Thank you so much for your kind attention.
Thank you, Brazil. I now invite the representative from the China, please.
Thank you, Chair. Distinguished delegates, dear colleagues, China would like to express our sincere gratitude first to the Russian presidency for hosting this meeting. We all know that the health and economic cost of communicable diseases and non-communicable diseases have created an impending threat to all nations and people. The BRICS country, has always attached great importance to the public health cooperation in our health cooperation. In the past, we enjoyed the achievements made by the TB research network of BRICS country and vaccine development centers. And the BRICS integrated early warning system for preventing mass infectious disease. I'm sure that this new mechanism of the BRICS experts meeting on public health will be another success in our health cooperation. I wish this meeting a great success and look forward to work with you. Thank you.
Thank you, China. And now we will hear from Egypt, please.
Thank you, Chair. Do you hear me?
Yes.
Yes. Your Excellency, Dr. Olga, Director of the Russian Institute of Health, distinguished representative of BRICS member state, leaders in public health, ladies and gentlemen. On behalf of the Arab Republic of Egypt, I extend my heartfelt congratulations to the Russian Federation for hosting this highly timely and relevant event, where we will discuss the proposal for establishing a public health research network within the BRICS framework. As a proud BRICS member, Egypt is honored to contribute to this initiative aimed at enhancing our collective capabilities in addressing global public health challenges. Today's gathering marks a pivotal step in advancing our collective efforts to improve public health research. The proposed network represents an opportunity to harness our diverse expertise and resources and to drive innovative solutions to some of the most pressing health challenges faced by our nations and the world at large. Together, as a BRICS nation, we share a commitment to equity, innovation, and solidarity. These values drive our collective efforts to tackle global public health challenges that transcend borders by establishing this network. We look forward to create a dynamic and inclusive platform that facilitates the exchange of knowledge, foster innovative research, develop strategies and best practice that are both impactful and inclusive across our member states. This will enhance our ability to respond to emerging health threats, conduct innovative research, and implement evidence-based solutions more effectively. Today's discussion are crucial as we lay the groundwork for this network. Egypt is committed to supporting this endeavor and believes that through our collective efforts we can build a network that not only serves the BRICS nation but also become a cornerstone of public health research, fostering breakthrough and creating impactful solutions that contribute meaningfully to global health advancement. And thank you.
Thank you very much, Egypt. And we don't see representatives of Ethiopia, so I invite the rep of India, please.
Distinguished delegates and esteemed colleagues, greetings from India. We congratulate the Russia for this excellent initiative. I am Dr. Avdesh Kumar, Additional Director Public Health and Head Epidemiology at National Center for Disease Control, Delhi, India. It's a great honor to address this August gathering at the BRICS experts meeting on public health. India is making significant strides in the field of public health through National Center for Disease Control, NCDC. NCDC is a premier institute in disease surveillance, outbreak investigation, response, and capacity building. It has played a critical role in responding to the public health threats such as KFD, Casanur forest disease, Nipah virus, and Crimean Congo hemorrhagic fever, etc. It leads several national health programs, including Integrated Disease Surveillance Program, IDSP, which serves as the backbone, and over 1,500 outbreaks are investigated annually. Our strategic approach includes applied and operational research, technical advisory, antimicrobial resistance, and training programs for health officers across India and Southeast Asia region, such as India Epidemic Intelligence Service, which is in collaboration with CDC Atlanta. NCDC also acts as national focal point for international health regulations. As National Public Health Institute, NCDC not only supports national health programs or the national health security, but also contributes to the global fight against public health challenges. We look forward to strengthen our partnerships within BRICS to collectively enhance our public health response capabilities, share the best practices, and build a healthier future for our great nations. Thank you very much.
Thank you very much, India, and I invite representative of Iran, please.
Thank you. Can you hear me? Excuse me, can you hear me?
Yes, sure, please.
Yes. Hello. I am Dr. Abbas Alipur. I am epidemiologist and head of Network Management Center of Ministry of Health of Iran. Honorable Chairperson, esteemed colleagues, and distinguished participants. It is a privilege to represent the Islamic Republic of Iran at this inaugural BRICS experts meeting on public health. This gathering marks as an important step toward strengthening collaboration to improve our public health systems and enhance the well-being of our citizens. Iran strongly supports the BRICS Public Health Research Network, believing that by pooling our knowledge, we can tackle global health challenges and increase the resilience of our healthcare systems. Our focus on both communicable and non-communicable diseases, coupled with advancements in health technology, aligns with the goals of this initiative. This meeting is a valuable opportunity to deepen our diplomatic relationships and work together on solutions that enhance our collective capacity to address health crises. Iran is eager to contribute its expertise to this important dialogue. Here are some offers for the BRICS Public Health Research Institute or programs. 1. Joint research on priority health issues. Objective: collaborate on NCDs, non-communicable diseases, infectious diseases, and digital health to develop policy solutions. 2. Data sharing and health surveillance network. Objective: real-time data sharing to support outbreak response and evidence-based policymaking. 3. Capacity building and training programs. Objective: develop training programs to build the capacity of public health professionals. 4. Collaborate digital health initiatives. Objective, establish shared telemedicine and digital health platforms to improve healthcare access. 5. Public Health Innovation Fund. Objective, support research in healthcare technologies and public health innovation. We believe that our joint efforts will lead to significant health improvement. I wish everyone a successful meeting and thank you for this opportunity.
Thank you very much, Iran. Dear colleagues, let's check again if we have Saudi Arabia or Ethiopia. Colleagues, please speak up if you are here. No? All right. Let's move to next session. Thank you all for the insightful opening remarks. We will now move on to presentations from each country on their public health institutions' interest and propositions. Each country will have 10 minutes to present. Please stay within this time limit so we can maintain the schedule. We begin with Russian Federation, and it's a pleasure to represent the Russian Federation today and share some of our key initiatives in strengthening our health system. I will speak on behalf of the Russian Research Institute of Health, and my colleague, Dr. Anna Kontsevaya, will speak on behalf of the National Medical Research Center for Therapy and Preventive Medicine. Slide, please. First of all, Russian healthcare system is highly structured, focusing on efficient delivery at multiplied levels across 89 regions, ensuring that medical services are accessible to all citizens, from primary care to advanced medical treatment. Our institute are leading in health system governance, public health, and digital transformation of healthcare system in Russia. There are our three major areas of focus. As the institute responsible for healthcare digitalization in Russia, we provide data-driven policy recommendation for the national and regional healthcare systems, helping share health policy and management. We conduct research on public health issues, risk factors, and provide regulatory frameworks for advancing healthcare legislation. We also collaborate with Russian-speaking countries to harmonize healthcare regulation. Our institute, with over 30 years of experience, has developed more than 1,000 policies, guidelines, and methodologies. Russia is a vast country with regions that are dramatically different. And we are at the forefront of crafting and implementing organizational models and optimized healthcare system and are tailored to the unique challenges of financial and human resources constraints. One of the core solutions in this is the assessment of health systems at both national and regional levels. We evaluate health system based on 6 areas that you can see on the slide. By providing extensive analysis, we help local governments identify their strengths and weaknesses, enabling them to prioritize areas for development and implement specific action steps. Our approach is centered around data-driven decision-making. We collect and analyze medical statistics, which are then used to guide decision at the national and regional levels. We manage vast data sets, develop digital forms and documentation, and handle reporting systems. Our goal is support establishment of robust digital infrastructure that enables healthcare leaders to make timely and informed decisions and to address the challenges in their regions and nationality. A critical component of our work is the development of the healthcare workforce, specifically at top management level. Through initiatives like the Health Ministers Academy and Health Ministers Club, we provide in-depth training for newly appointed regional health ministers, foster idea exchange and help address current healthcare challenges through in-person workshops and consultation with top experts. Our work extends beyond Russia. We are actively involved in international collaboration through the WHO Collaborating Center that are based in our institute, including information system, statistics, and analysis. In addition, we are design organization of CIS countries on public health and digital transformation and coordinate a network of CIS institute in these areas. These two entities serve as a platform to address common public health challenges, share best practices, and implement intergovernmental healthcare strategy, public health and CIS region. And we also manage a human talent platform for leaders in healthcare of CIS region. We are eager to collaborate with international partners. Our flagship research project are on this slide. You can see it. These initiatives align with the global goal to enhance healthcare delivery, workforce capacity, and public health outcomes, and offer ample opportunities for potential collaboration with our Bricks partners. And now I pass the floor to my colleague, Dr. Anna Kontsevaya. Anna, please.
Dear Olga, dear colleagues, thanks a lot for this wonderful opportunity to present our center on such outstanding expert meeting on behalf of Russian Federation. Dear colleagues, I have to demonstrate my slide by, thank you. Next slide, please. So our National Research Center, next slide, please. Our National Research Center is 75 years old center with lots of expertise area, but I will focus mainly on the area of public health and the additional topics in this area which we can present is population health and health environment, its neighborhood environment, and the infrastructure for healthy lifestyles, and so on. Our another area of expertise is epidemiology of NCDs and its risk factors. Here we conducted the biggest epidemiology surveys across all over the country with 60,000 participants, which are followed up during the 10 years. And we know how to estimate not only the prevalence of the risk factors, but also the impact of the different health interventions on the population lifestyles, and using this data for arguments for policymakers. The third area is economics of health, and this area I will explain in details on the next slides. Also, we do lots of work in the primary care area, screening in the Russian Federation's so-called dispensarization. Its content, its model of its conducting in the primary care, follow-up of the patients, and other areas. And the last, but not the least, is digital prevention. Digital prevention in the format of mobile apps, in the format of digital platforms, which we plan to introduce during the next big national project. Next slide. And just a couple of points about this our area. As a WTO Collaboration Center, we worked a lot in the different countries of the world, making so-called investment case in NCDs, in mental health, and in some other diseases. And this investment case includes the arguments on economic burden of the diseases or risk factors and the economic impact of the interventions packages. And we provided these arguments in the level of the governments of these countries and made the calculations, write the reports, and then present them on the big multi-sectoral forums in order to provide the ministries of health with the arguments to talk with Minister of Finance or Minister of Economic Development or other ministries to convince them that investment in health is a real investment, but not just social spending of the money. Next slide, please. And this, for example, is a couple of the examples of the return of investment in the short-term area in 5 years, for example, how much the country can return if they invest in the population health. And of course, we will be happy to share this expertise with the countries presented in the today's mission. Next slide, please. And also we have the experience of providing international trainings. For example, this is example of the training courses on epidemiology and statistics, which we provide already in several countries, how to do this epidemiology survey, how to calculate the results, and how to use this data again in the communication with policymakers. Next slide. I think this, and thank you for your attention. This is very briefly our main areas. Thank you, Olga Sergeyevna, colleagues, for this opportunity.
Thank you very much, Dr. Anna. We work together with Institute, and now we will hear from South Africa, please. South Africa, are you here? Okay, in this case, let me opportunity to give the floor to United Arab Emirates rep, please.
Thank you, Chair. Can you hear me?
Yes.
I will be giving an intervention and not a presentation. So thank you again, Chair. We find ourselves at a crucial juncture where global health systems are encountering unprecedented challenges. It is imperative that we move forward by embracing a collective and cohesive approach to address these challenges. Chair, within UAE, we face several significant public health challenges, particularly the rising prevalence of NCDs, such as diabetes, cardiovascular diseases, and obesity, driven by these sedentary lifestyles and unhealthy diet. Mental health issues are also a growing concern, but remain stigmatized, which limit access to appropriate care. Rising healthcare costs, largely due to the demand for advanced medical technologies and the treatment of chronic diseases, further strain our national health system. However, there are considerable opportunities for growth in our healthcare sector. We are prioritizing the preventive healthcare initiative, focusing on promoting healthier lifestyles and reducing the burden of NCDs. The expansion of public-private partnerships is encouraging more private sector involvement in healthcare infrastructure and service delivery, fostering innovation. Moreover, there is a growing emphasis on digital health and telemedicine, as well as efforts to strengthen primary health care services to reduce our reliance on tertiary care. These efforts are aligned with our national strategies to enhance healthcare outcomes and build a more resilient and sustainable healthcare system for the future. As mentioned earlier, a cohesive approach is what is required to leverage from these existing opportunities and tackle ongoing public health challenges. Hence, we would like to suggest three key areas for the focus of this esteemed group. One, exchange of best practices. We welcome the establishment of the BRICS Public Health Research Network. This network offers a timely opportunity to enhance cooperation and share expertise, laying the foundation for sustainable health system across our nations. By sharing successes in epidemic control, chronic disease management, and health governance, we can learn from one another and adapt these lessons to our specific national context. Two, addressing health challenges together through research. Our countries face both common and unique healthcare challenges, whether it's digital health transformation, NCDs, or pandemic preparedness. Collaboration is essential to overcoming these obstacles. Collaborative research will undoubtedly lead to innovative solutions that can be applied both bilaterally and multilaterally. Three, resource pooling. The network could become a platform for joint forums, symposiums, and initiatives. By pooling our knowledge and resources, we can strengthen our respective healthcare systems and improve the resilience of our population against emerging health threats. Through solidarity, mutual objectives, and innovation, we can tackle today's pressing public health challenges and prepare for those of tomorrow. Thank you, Chair.
Thank you very much, United Arab Emirates. And we will now hear from China, please.
Distinguished guests, Chairman, and good morning, good afternoon, good evening. I'm from China CDC, and taking this great opportunity, I would like to give you a brief introduction of the infectious disease control and prevention. I would like to elaborate from the 3 points. First of all, that is the main achievements of the prevention and control of the infectious diseases. It is greatly related to the safety and the health of the people, and it has a direct bearing to the economic and social development as well as social security. China has always adhered to the principle of prioritizing prevention, the combination of prevention and cure, and we have achieved some tremendous achievements. Mainly, we would like to elaborate it from the 3 points. So, the first point is the eradication of some infectious diseases. After the eradication of smallpox, filariasis, polio, as well as neonatal tetanus, in 2021, China has obtained the certification of the eradication of malaria by WHO. And it has a historical significance in public health in China, which also having made great contribution to the global health endeavors. And secondly, we have controlled some infectious diseases. Currently, AIDS, TB, hepatitis B, hepatitis C, schistosomiasis, as well as other infectious diseases are under effective control. And AIDS transmission has been mainly brought through the blood transfusion and the products. So such a kind of endemic has been maintained at a low level. And the prevalence of TB has been steadily reduced, and the treatment rate has maintained at more than 90%. The fatality rate has reduced to the level of the advanced nations. Viral hepatitis, the number of which had been greatly reduced through such a national immunization plan, and we have popularized the inoculation of hepatitis B vaccination, and the infectious rate under 5 years old is maintained less than 1%. And schistosomiasis in 2023 in China, we have basically realized the blocking of the transmission nationwide. And the third one is the reduction of some diseases. For example, measles and the encephalitis and meningitis had been reduced to a historic low, the prevalence of which. And recent years, China will report above 500 to 600 measles, maintaining at an extremely low level in a global stage, and also echinococcus and ascariasis, as well as other diseases, have been greatly reduced. So this is the first point that I want to report to all of you. And the second one is basically about the new challenges that we are facing. Just as well as the challenges faced by all the BRIC countries, I would like to elaborate from the 5 points. First of all, the risks of the traditional infectious diseases cannot be ignored, for example, including AIDS and the AIDS new subtypes, the drug resistance, and the changes of the transmission networks, as well as the anti-retrieval viruses are having its great gaps. This is the new challenges faced by the prevention of AIDS. China has also been facing the problem of the drug resistance, which is really very serious, posing great challenges for us. And China remains such a high burden country with TB. So that is why for our fight against the TB, and we are still having a long way to go. Actually, during the COVID-19, also post the COVID, particular measles and scarlet fevers, we have seen the reduced inoculation rate among all the children globally, which pose challenges for the prevention of the diseases. And the second point that it is we are facing some unexpected situations for the newly occurred infectious disease since 21st century because of the accelerated processes of globalization and urbanization. We are facing increasing complexity and uncertainty for the new and emerging infectious diseases. There is a highly risks for the infectious diseases to be transmitted cross-border, not only in the 2003 SARS and 2019 H1N1, and in 2012 MERS, and 2014 Ebola, as well as the 2019 COVID, all of which are featuring such an epidemic of going beyond the borders, forming such a pandemic in a global scale, posing great damages, not only economically but also on human health. So we still are lacking of such a corresponding measure to the newly diseases. And third one is about what has been mentioned by the WHO as for the uncertainties of the X disease. In 2018, WHO had tried to remind all of us of the so-called unknown such pathogens and what we call as the X disease.
Early 2024, the WHO sent out the alarm loud and clear again for disease X. It is not a matter of when it will emerge. It is only a matter of when, not a matter of if. Therefore, it poses new challenges to the global combat. And fourth, climate change has changed the way of transmission of infectious diseases. Climate change has led to the increase of extreme weather conditions, the sea level rise, the loss of biodiversity, and all these pose grave challenges and threats to human health. In particular, they heighten the transmission risk of certain infectious diseases, for example, dengue fever, malaria, and other vector-borne diseases. And the fifth challenge is brought by aging, as it brings comorbidity burden. Aging is a major national challenge, and it puts a heavy burden on public health and social progress. The acceleration of aging has heightened the overall burden of NCDs. They also increase the transmission risk of infectious disease. Aging has brought an array of difficulties for China's disease prevention control. In response to the above-mentioned challenges, China has put forward the following countermeasures. I'd like to emphasize a few. First, that we should adopt a multi-pronged approach and consolidate our prevention control system. We must enhance government's leadership role in the infectious disease prevention control. We must unite the government, departments, and different organizations and individuals' responsibilities. Besides, we must approach the difficulties from building a stronger response system to reduce the risk of occurrence and prevent outbreaks. And third, we must uphold the principles of prevention, scientific control, timely and early warning, rapid response, and categorized response policies. We have a complete surveillance and early warning system for infectious disease control to identify the risks at early stage. We've also been making efforts to set up our surveillance system, response mechanism, and preparedness plan. We set up a highly effective commanding system to timely respond to any outbreak. Besides, we've been improving the citizens' literacy and awareness to effectively control the key risk factors. So that's our national efforts. At the global level, we've been pursuing One Health mindset and uniting different forces to co-build the system. We've been focusing on the following aspects. First, the health mindset must be deeply rooted in the socio-economic development plan. We must improve the legal system on public health. We must set up a comprehensive infectious disease comprehensive surveillance system to improve risk assessment and early warning capacity. Besides, we continue to support government in their leadership and intervention programs and increase investment. Third, we've been innovating and promoting the integration of medical treatment and prevention, beefing up infectious disease control workforce, and improve the surveillance early warning, epidemiological survey analysis, lab testing, medical treatment, medical countermeasures support, core capacity of health institutions, vaccination, vector control, quarantine, and other non-pharmaceutical intervention measures are also delivered. With enhanced vaccine, pharmaceuticals, diagnostics, and prevention and control strategies, research and development, and the application of research outcomes. Guided by the One Health concept, we've set up a regular cooperation mechanism among multi-stakeholders, and we've been promoting health education on various channels to promote healthy lifestyle. Finally, China stands ready to actively participate in global infectious disease prevention control under the framework of IHR to put into practice our concept of building a community of health for all. We stand ready to cooperate with all BRIC members to respond to global issues, including infectious disease. Thank you.
Thank you very much, China. And now I invite Brazil to present, please.
Thank you so much. I will present some characteristics of our institution first, and after our expectation regarding the collaboration in public health research we have from this meeting, from the network proposed by the Russian Federation. The Oswaldo Cruz Foundation, as I said in my first approach, is the National Institute of Public Health of Brazil. Founded in 1900, it will celebrate its 125th anniversary in 2025. It's an old institution, but a renewed institution each year, each moment. It's a state institution affiliated to the Brazilian Ministry of Health. And its mission is to promote health and social development, generate and disseminate scientific knowledge and technologies, and be an agent of citizenship. Fiocruz generates knowledge and provides products and services to the Brazilian public health system, known as Unified Health System. The acronym is SUS. And the SUS is one of the largest public health systems in the world, universal and free, based on the recognition of health as a right for all and a duty of the state. And SUS is responsible for the health promotion, prevention, and health care to the entire 210 million Brazilian population. We work for the Brazilian Unified Health System. I mean, Fiocruz works for the Brazilian Unified Health System through our research and development ecosystem. Its organizational structure is composed of 16 institutes distributed across 12 of the 27 Brazilian states in the 5 regions of the Brazilian territory, including the Brazilian Amazon. And it's our headquarters, as well as most of the institutes, are located here in the city of Rio de Janeiro, in the southeast of Brazil. I will send the presentation slides to be distributed in order to be possible, you know much better our institution. And we act at all levels of the public health system. The institution, Fiocruz, conducts health research in the biological and biomedical fields, public health, and when I said public health, I mean research in epidemiology, demography, health systems and services, and social sciences applied to health. And finally, clinical research. That is, our conception of public health research is a broad dimension, has a broad dimension, including the biological and the biomedical fields, epidemiology, demography, health systems and services, research and social sciences applied to health, and finally, as I said, clinical research. And our interest in this in the BRICS network is to get collaboration, cooperation in terms of methodologies for analysis of the situation of health systems and services, its structure, functions, governance, resources, and taking as reference maybe the building blocks of health systems of WHO, probably known by all of us, the building blocks of health systems and the analysis that we should done together within our health systems on the blocks of health systems proposed by WHO, for instance. Population health and health system services, the analysis of demographic and the biological situations, and how this knowledge influence or are taken in account to build the health system, plan health system, and organize services for the population. Because we used to say, yeah, the biological and demographic data are very important, but how to take in account in the moment of planning the health systems and health services in the country, it's a question opened in many health systems. Other dimension we are very interested in how the social determinants of health, I mean, the influence of other ways of life, other dimensions of the society influence the health systems and services in our countries. And to better understand the primary health care and other levels of the system, components, dimensions, threats, challenges, possibilities, how we organize the health systems in these dimensions of the several levels health systems use to be organized. Our greatest interest would be to know in greater depth the structures, functions, governance of each health system of the BRICS countries. This is with the aim of taking advantage of governance experiences developed in each BRICS systems, and also the successful practices of health promotion, prevention, and health care. And to know and share experiences of health care through primary health care, and also care at other levels of the system, such as intermediate specialized care and the hospital level. How population access the health system, how is the health system financed, and the relations between the public and private sectors, how the system start new technologies, offer new technologies, drugs, vaccines, etc. I mean, the supplies for health, the supplies for the health population, how is accessed, how is financed. I mean, it's to understand the best practice in these many dimensions of the health system. This is our expectative. This is our, we are hope to have this kind of cooperation, because BRICS represents the voice of South, the global South, and the experiences of our countries belonging to this global South. It's quite important because we have many common problems, and we can choose, and we can know, and we can elect new technologies to face the problems we have in common. This is my first approach about the expectations we have about the health, this network of health research. Thanks so much for your kind attention.
Thank you very much, Brazil. And now Egypt will present. Please.
Thank you, Chair. Can you hear me?
Yes.
Okay. Public health is a cornerstone of societal well-being and economic stability. The Arab Republic of Egypt, with its rich history of public health initiatives and its ongoing efforts to improve health outcome, strongly supports the creation of a collaborative research network that will serve as a platform for shared knowledge, innovation, and best practice. As we delve into this topic, I am honored to share with you the strides Egypt has made in this vital sector. Our commitment to enhancing public health is evident through a range of initiatives and achievements that underscore our dedication to improving health outcomes both domestically and internationally. First, successful disease control and prevention. One of our most notable achievements is our massive nationwide campaign for hepatitis C virus elimination. This ambitious initiative has led to a dramatic reduction in the prevalence of the disease, positioning Egypt as a global leader in effective disease management and treatment. Our comprehensive approach has set a benchmark for hepatitis C treatment worldwide and serve as a model for other nations facing similar challenges. Second, strengthening health system. Egypt is deeply invested in strengthening our health system. We have embarked on an extensive expansion of health insurance coverage aimed at ensuring that every Egyptian citizen has access to essential health services. This effort is particularly focused on reaching underserved population, thereby improving health equity and access across the country. Third, enhancing public health infrastructure and training. We recognize that robust infrastructure is crucial for delivering high quality healthcare. To this end, Egypt has made significant investment in upgrading healthcare facilities and expanding training programs for healthcare professionals. These investments are designed to enhance service delivery and patient care and enabling us to better respond to health crises, ensuring that our healthcare system is well equipped to meet the needs of our population. As we discuss the formation of a BRICS Health Research Network, I'd like to highlight Egypt's key interests and proposition to support the development and success of the BRICS Public Health Research Network. Firstly, enhancing disease surveillance and control. Effective disease surveillance is vital for managing public health threats. To this end, we propose the creation of a BRICS Health Data Exchange platform. By leveraging this platform, BRICS countries can continuously share real-time health data, and research findings. This collaborative approach will enhance our collective ability to track these trends, coordinate response to health crises, and make evidence-based policy decisions. Secondly, strengthening health system and infrastructure is crucial. Robust health systems are essential for providing equitable and efficient healthcare services. In this regard, Egypt is committed to supporting the BRICS Public Health Research Network's effort to enhance health system and infrastructure. We aim to contribute by sharing our experiences and insight, promoting collaborative approach, and exchanging best practice within the network. This collective effort will help drive advancement in health management strategy and strengthen healthcare delivery across BRICS member countries. Our third interest lie in strengthening health emergency preparedness and response. Efficient preparedness and response mechanisms are crucial for managing health emergencies. Therefore, Egypt is committed to supporting the BRICS Public Health Research Network by focusing on research to enhance health emergency preparedness and response. Our effort will include investigating collaborative response strategies, sharing expertise, and evaluating existing framework. Through dedicated research, we aim to refine our collective readiness for health emergencies, such as pandemic and natural disaster, and improve our overall approach to these critical challenges. Fourthly, promoting health equity and improving access to healthcare services. Ensuring that all individuals have access to quality healthcare is a fundamental goal. We are committed to supporting efforts to address disparities in healthcare access and expand coverage in underserved areas. Leveraging Egypt's experience in health insurance expansion, we aim to contribute valuable insights and frameworks to enhance health equity across BRICS nations. Fifth, strengthen public health workforce. We support the network effort to strengthen the capabilities of public health professionals through initiatives such as health training and exchange program. This program will facilitate the exchange of knowledge and skills among health professionals from BRICS countries. By providing training in areas such as disease management, health policy, and research methodology, we will strengthen the capabilities of our public health workforce. Finally, promoting preventive health measures is essential for reducing the disease burden. We endorse the development of a BRICS preventive health strategies. This initiative will focus on advancing preventive health measures through the exchange of successful practice, development of joint guidelines, and collaborative research on effective preventive strategies. By sharing knowledge and resources, we can enhance our collective efforts in areas such as health education, early detection, and lifestyle intervention. This collaborative approach will support improved public health outcomes and contribute to global health security. Allow me to, in addition to these core interests, Egypt advocates for several strategic actions to ensure the effectiveness of the BRICS Public Health Research Network. First, setting clear objectives and priorities. It is essential to define specific goals and research areas that align with the public health priorities of BRICS countries. This focus will guide the network's activities and ensure that we achieve meaningful and measurable results. Second, promoting inclusivity and equitable participation. To foster a collaborative and inclusive environment, we must ensure that all member countries have the opportunity to contribute to and benefit from the network's initiative. Equitable participation will strengthen our collective efforts and outcomes. Third, encouraging public-private partnership. Developing partnership with academic institutions, private sector entities, and non-governmental organizations will be crucial. This collaboration will help leverage resource and expertise, enhancing our public health research and intervention. Fourth, facilitating continuous knowledge sharing. Establishing robust mechanisms for ongoing communication and the exchange of best practice among BRICS countries is vital. This will keep the network dynamic, responsive, and up to date with new development in public health. Finally, fostering innovation, encouraging joint research and development projects to address emerging health challenges and advance public health solutions. In conclusion, Egypt is dedicated to actively participating in and supporting the BRICS Public Health Research Network. Our strategic action reflects our commitment to advancing global health through innovation, collaboration, and shared expertise. We look forward to working closely with our BRICS partners to achieve our common goal and make a significant impact on public health. Thank you, Chair.
Thank you very much, Egypt. And now I invite India to present, please.
Presentation. Requesting you to kindly share the presentation from India.
Please.
Thank you for this opportunity. So we are happy to present the India National Center for Disease Control, which is the the National Public Health Institute for India, and it is a subordinate office of Directorate General of Health Services under the Ministry of Health, Government of India. Next slide, please. Going to the history of NCDC, which is the National Center for Disease Control, it was started as the Central Malaria Bureau. So initially, the burden of malaria was high, so this institute was established in the hills of Himachal Pradesh, Kasauli, and then the base was shifted to Delhi, which is the capital city of India. And finally, as the burden of diseases changed and the epidemiology evolved, NCDC assumed the status of National Institute of Communicable Diseases in 1963, and during the centenary celebrations in 2009, it was named as the National Center for Disease Control, encompassing the non-communicable disease role as well. Next slide. So the major public health contributions as the NPHI has been the smallpox eradication in 1979. Then we initiated the National Surveillance Program for Communicable Diseases, which was piloted on a systematic approach for response to outbreaks and surveillance of outbreak-prone diseases in 1997, which has finally transitioned to the electronic near real-time based reporting as the Integrated Health Information Platform in 2016. And we also contributed to the guinea worm elimination and yaws eradication by neglected tropical diseases. During the COVID-19 pandemic response, the initial response was orchestrated through this NPHI NCDC, and we were instrumental in the containment activities. MPOX response also we supported the Ministry of Health by providing the technical and public health response guidance. Next slide, please. The overall mandate of the National Center for Disease Control is control, elimination, eradication of the communicable diseases. However, our mandate has been also increased to take care of the non-communicable diseases, the newer public health threats like climate change, non-communicable diseases. And we have the countrywide surveillance of epidemic-prone diseases and provide technical assistance to the states and also at the national level for outbreak investigation and containment. We have a laboratory structure and a network of labs which provide referral diagnostic services. NCDC is also designated the international health regulation focal point for the country implementation part. And the main mandate of NCDC is very cross-cutting in area of human resource development, which happens in areas of epidemiology, laboratory, IPC, with the newer programs coming in like AMR. And also we provide technical support to national health programs, and also 10 national health programs are implemented by the National Center for Disease Control. Next slide. How the institution functions is through its technical divisions. So we have some public health divisions, some laboratory divisions, and some of the cross-cutting divisions. Name a few, we have Division of Epidemiology and Training. We have Center for One Health, Integrated Disease Surveillance Program, the Central Surveillance Unit, as we understand, India is a federal country. So the Central Surveillance Unit at the national level is housed at NCDC with its branches in the states at the State Surveillance Units, and then going down to the district at the District Surveillance Unit. Recently, we have also have this Center for Environment, Occupational Health and Climate Change and Human Health. And there is a Center for Arboviral and Zoonotic Diseases to take care of the emerging zoonotic threats. We also have a division of AIDS-related diseases, medical entomology and vector management, and cross-cutting divisions like Division of Statistical Monitoring and Evaluation. Everyone who talks about AMR. So we have a Center for Bacterial Diseases and Drug Resistance, which also houses the AMR program unit. Next slide, please. NCDC is recognized as a WHO Collaborating Center for Epidemiology and Training, and it is the regional capacity building hub for the Southeast Asia region. with the collaborating centers for rabies epidemiology, and our epidemiology programs are also university affiliated. Then we are the National Reference Center for Plague and HIV and the National Nodal Agency for SARS, avian influenza, pandemic influenza, and prevention and control of soil-transmitted helminthiasis, which is also a neglected tropical disease. And NCDC functions as a WHO national laboratory for polio, measles, and rubella. During the COVID-19 pandemic, the INSACOG unit was also, the genome sequencing unit was steered through NCDC. And we have also talked about various national health programs which are being implemented by NCDC. Next slide. Next slide, please. So NCDC implements 10 national health programs. Integrated Disease Surveillance Program is one of them, which has moved to the electronic version. Then we have the National Program for Containment of AMR, National Program for Climate Change and Human Health, and there are zoonotic programs like Intersectoral Coordination Program for Prevention and Control of Zoonosis, which has been renamed as Program for One Health, and leptospirosis and rabies, which are another two zoonotic diseases, viral hepatitis, and the diseases which we have eradicated, like guinea worm and yaws, we have the human surveillance program, and recently launched program is on the snake bite and venom. Next slide, please. This slide captures the early response to COVID, which was orchestrated by NCDC from providing the technical inputs to the Ministry of Health, setting up of the quarantine centers, coming up with the containment strategies and outbreak investigation, cluster investigations, and finally doing all the technical advisory work for COVID until it was revoked. Next slide. So sharing few of the best practices from NCDC is one of the surveillance platforms which we have is the Integrated Health Information Platform. It was designed by WHO and it provides real-time case-based information system with integrated analytics, including geospatial information. It integrates the information from multiple sources and captures disaggregated data or the case-based data, which is auto-generated into reports with advanced visualizations. It is a single platform for multiple programs, and it houses also the National Malaria Elimination Eradication Program, Kala Azar Control Program, the Filaria Control Program, Program for One Health, Oral Health Program, the Guinea Worm Eradication Program, and also it has started the community-based portal, which also helps the community to share the early warning signals or alerts, which can be then taken care of by the Central Surveillance Unit and the District Surveillance Unit. We are also trying to develop the collaborative surveillance module on IHIP so that with the One Health approach, we can generate early warning signals for prevention and control of zoonotic events. Next slide. Coming to another sharing of best practice, which is the National Program on AMR Containment. So the AMR Containment Program was initiated in 2013, soon after when WHO has taken a call as a World Health Day theme in 2011 as the AMR program. So AMR surveillance is conducted through sentinel sites, which are 16 number across 33 states. And it focuses on strengthening of the lab capacity. And now recently the AMR surveillance has also been upgraded to include the fungal pathogens, namely the Candida species. And then we have the Infection Prevention and Control Unit also under the Division of Bacterial Diseases and Drug Resistance. And the national guidelines were published by the program, and training of trainers have been conducted in the states. And also IC material related to antimicrobial use, the judicious use, and the national treatment guidelines are underway and have been developed. So these are all iterative things. And international collaborations also do exist for this program with Netherlands and also the Fleming Fund. Next slide. Another core area of NCDC is the field epidemiology workforce development for the country, as we require one epidemiologist per district. So we have all the 3 tiers available or being run through NCDC, the basic course, intermediate course, and the advanced course. So these 3 tiers, we have the advanced course, which is the India Epidemic Intelligence Service course, which was initiated with support from CDC, and now it has been brought back to the domestic funding. And NCDC is also the collaborating center which supports the regional field epidemiology capacity building in the region. And we plan to expand this further to other countries. And a roadmap was developed as the One India FETP roadmap, which also aligns with the state policies to augment the epidemiology workforce, because we need to scale it, upscale it to reach the level of sub-district. Next slide. Next best practice would be to share the practice from the Sector Connect, which is field epidemiology in One Health. So NCDC's the core area of work was human health training component, but then we moved to the intersectoral coordination with advent of many emerging infectious diseases. So this training is cross-sectoral, where we have participation from various sectors like the animal sector, wildlife, food safety, and also the points of entries. And it provides something for everyone in form of the joint risk assessments, which can be conducted, integrated outbreak management, collaborative surveillance. So this program is basically for the rapid response teams at the district level, which is the ground level or the frontline level. And it provides many cross-learning opportunities and resource sharing platform for the people from various sectors. Next slide. NCDC is into its phase of expansion through the NCDC state branches in all the states, and also 5 regional centers to take care of the regional priorities of the diseases which are prevalent in the country. And COVID also highlighted the need for urban surveillance. So NCDC has planned to establish 20 metropolitan public health surveillance units in the selected metropolitans, and also a lab network of laboratories is coming under the institution. And integrated health information platform expansion is also envisaged. Next slide. The way forward or collaborations which we envisage through this network is integrated health information portal, the surveillance practices, and epidemiology training and emergency preparedness and response training. So this will provide cross-learning opportunity through faculty exchange and also sharing of the best practices at various levels, the national, subnational level, in the area of surveillance through our integrated health information platform. So we are in the world of digital health, and this would be a good practice to share with other countries. Next. Next slide. Thank you and namaste from India.
Thank you, India, too. And I give the floor to Iran, please.
Hello, can you hear me?
Yes.
Okay, it's a great pleasure and a great honor to present on behalf of Islamic Republic of Iran National Institute for Health Research. Um, Today I will present on behalf of this institute. This is a national public health institute that is affiliated both to Iran Ministry of Health and Medical Education and also to Tehran University of Medical Sciences. I am Ali Akbari Sari, Director of NIHR at Iran. So the outline of my research will be to very briefly overview how we do the governance of public health research in Iran, and then we'll give you some examples to provide more detail about how we do public health research in Iran, actually research centers, universities, and departments, and then we'll make some suggestions for collaboration and joint projects. Just to talk about the Iran health system, actually in Iran, over 95% of people they are covered by public health insurances, and the health benefit packages are very wide, and it somehow cover most of the services like medical procedures, medicine, lab tests, medical devices, imaging, and even we do coverage of some dentistry services. In terms of primary healthcare network, we have a very strong primary healthcare network in all actually country, even in very remote areas and in small villages and cities. And we have some implemented the family physicians from about 20 years ago, 15, 20 years ago, but a family physician has not fully implemented yet. And in primary healthcare, actually network, we have over 170 public health program that are implemented, and we are expanding this program. In terms of the governance of health research and public health research in Iran, this is generally governed by Iran Ministry of Health and Medical Education. You know that in Iran, we have somehow merged Ministry of Health and somehow higher education in health system. So we have Ministry of Health and Medical Education. And as part of actually Ministry of Health, we have Islamic Republic of Iran, NIHR, National Institute for Health Research. In addition to that, we have about 70 medical universities, and under the umbrella of these medical universities, we have over 3,000 departments and over 750 research centers. And under these, we have a lot of research staff, faculty members, research fellow, and so on. In addition to this system, we also have a granting body that is called NIMAD, and it's very similar to a medical research council granting body. So we do public health research by a combination of these systems. For example, NIHR mainly do research with pooling sort of mechanisms, and NIMAD, this is a granting body, support research that is mainly pooling research, coming from the environment, like the departments and the research centers and the researchers. And all these actually 750 research centers are affiliated to Iran Medical University. So we somehow do research by a combination of this system. We also have some other national research centers, like for insurance, for human resource, for law, for education, and for equity. But all of this system is governed by the Ministry of Health and Medical Education. Today, I'm talking on behalf of NIHR, National Institute for Health Research. So the main mission of, actually, I've got another one slide. That's the history of this institute. So it started from 1951 as Malariology Institute, and it contributed significantly to the elimination of malaria in Iran. Then it changed to Malariology and Parasitology Institute, then changed to Parasitology and Tropical Disease Institute, and then in 1965 to Public Health Institute. Then it was somehow merged with a public health school, and the name became a School of Public Health and Public Health Institute in 1966. And again in 2008, this was separated from School of Public Health, and the name changed to National Institute for Health Research, because at this time we had some more problems with regard to the non-communicable diseases as well. So the main mission and responsibility of NIHR is the first one, that's a sort of national observatory system for the government. So we do a lot of observatory of health system and observatory of health as well together. And in addition to that, we do health policy and system research for the government and for the Ministry of Health. We also do some KTE, knowledge translation and exchange activities. And we have initiated and developed a rapid response system for policymakers, again, for Ministry of Health, to answer very quickly the questions that coming from Ministry of Health. Because in COVID-19, actually epidemics, we needed to answer some of the questions in a matter of hours or days. So we somehow developed this system to help the policymaker more. So these are the type of research that we normally do in NIHR, and these are somehow making and expanding the national capacity for evidence-informed policymaking in the country. So all of these 8 actually aspects have got a subset. For example, we have a system of evidence-informed policymaking, and these 8 items are the subsystems. For example, the first one is health information system. The second one, health technology assessment, clinical guidelines and public health guidelines. Then surveys, as I mentioned, rapid response system, KTE activities, and finally the rest of research goes to general health policy and system research. So these are the 8 main types of research that we normally do, and I explained very briefly some of these because of the limited time. For example, we have a department for observation, and under this department, we do some national health observatory activities. We have a multi-year action plan. This is a 5-year plan for national surveys. We have implemented 2 5-year national plan, and we are implementing the third one. And in this actually plan, we have included about 20 national surveys, and out of these 20, 12 of them has got more priority. So some of these surveys we do every year, some of them every 3 years, some of them every 5 years, and some of them even every 10 years. For example, we have non-communicable disease for adult, non-communicable disease for young people, and we have like smoking for young and for adult people, and we have many like national health accounts and many other surveys like utilization, health services utilization. So one important actually responsibility is to do these types of surveys. The second issue is with regard to rapid response system. As I mentioned, we initially developed this system in 2014 when I started a very big national health reform. And as part of that reform, we somehow initiated this rapid response plan to help the policymakers with regard to this health sector reform. And again, in COVID-19, in 2020, we expanded this rapid response system. I think we trained about 20 faculty members, full-time faculty members, and they were somehow ready for any question receiving from the ministry. And sometimes the ministry needed the answer in 2 days, like 48 hours. For example, as one example, we did this for example, remdesivir, and the question was, is remdesivir effective and cost effective for COVID or not? And we needed to do a very rapid health technology assessment in 2 days and send the response to the ministry to make decision on the basis of this information. And I think during COVID-19, we did over 50 sort of rapid reviews for policymakers, and we somehow translate these rapid reviews to policy brief and policy report and send this policy brief and policy reports to the ministry. And these are some of the selected topics that we suggest on behalf of Iran, actually Ministry of Health, especially Deputy for Public Health, and Iran NIHR that is affiliated to Ministry of Health and serve as part of the ministry. These are some, we think, ideas and topics that we can work together and we can somehow develop joint project and do collaboration. For example, with regard to combating burden of diseases, both communicable and non-communicable diseases and the strategies for BRICS countries to do that. Research with regard to universal health coverage,
Okay, we lost Iran. Let's wait a little bit. Okay, let's continue our agenda, and then if our colleague come back, we give him the floor. I think so. Iran was the last country in our panel, and I say thank you for all the presenters for providing valuable insights into
Okay.
the what?
This is South Africa.
Oh, okay. We have South Africa. Great.
Yes,
In
I
this,
do
in
about what.
this, in this way, I give you a floor. Please, South Africa.
Thank you, Madam Chair. I just would like to apologize on behalf of my health colleagues who are still in a meeting with our minister, but I've been asked to deliver this intervention on behalf of the country. So it is a privilege to address you today on South Africa's approach to public health, focusing on universal health coverage and health emergency preparedness and response. I would like to thank the Russian chair for convening this meeting, which we believe will contribute to strengthening the global architecture for public health emergency preparedness and response. We do note the progress that has been made by many BRICS member states in this regard. Indeed, public health emergencies arising from public health threats continue to be a major concern for many countries. South Africa recognizes the critical importance of a robust and adaptive global health emergency preparedness and response architecture. Our experience with health crisis from HIV and AIDS to COVID-19 has underscored the need for a comprehensive and innovative approach to safeguard public health. We are committed to enhancing our national and regional capacities while contributing to global efforts in this arena. We are currently dealing with the challenges brought about by the outbreak, which is once again burdening our health system. Member states need to have functional public emergency operation centers to fulfill the international health emergencies. South Africa is investing significantly in healthcare infrastructure to ensure readiness for emergencies. This includes upgrading hospitals, expanding diagnostics and treatment capabilities, and improving emergency response facilities. We are also committed to continuous training and development of our healthcare workforce. Our focus is on ensuring that health professionals are well prepared to handle emergencies through regular drills, simulations, and updated training programs. We are enhancing our disease surveillance system to ensure timely detection and response by integrating data from various sources and utilizing advanced analytics. We can identify and address potential threats and more effectively. It is my pleasure to inform you that South Africa recently approved the establishment of regional emergency hub after the Dakar and Nairobi hubs. This, which is a center for SADC countries in collaboration with WHO and Africa CDC to support African government to strengthen and integrate Africa's health emergency force, will be located at WHO country office in Pretoria. This initiative has the full support of my government, and we are doing everything in our power to ensure that it becomes functional as soon as possible. Madam Chair, dear colleagues, as you know, each of the 3 hubs will become centers of excellence and cater to its respective sub-region. The Nairobi Hub on workforce development, the South African Hub on research and development, genomic surveillance, and the Dhaka Hub will all have a particular emphasis on data, innovation, and intelligence. I am encouraged to know that the regional office plan to promote connections with WHO headquarters and other international partners, as well as coordinate and harmonize the hub's operations to guarantee adherence to WHO standards. BRICS' commitment to collaborating with Africa can be leveraged to ensure that we realize better health outcomes. South Africa recognizes the significance of this goal, particularly focus on financial risk protection and encapsulated in target 3.82 of the SDG, as well as UHC. Target 382 aims to reduce the number of people facing financial hardship due to health expenses. This target is essential because high out of pocket costs can lead to financial strains, prevent people from seeking necessary care, and contribute to health inequities. About 2 billion people are facing financial hardship, including 1 billion experiencing catastrophic out-of-pocket health spending, which is part of SDG indicator 382. Sorry, Madam Chair. As of the most recent data available, approximately 500 million people in Africa face financial hardship due to out-of-pocket health expenses, a significant indicator of the challenges related to target 3.8.2 of SDG 3, which focuses on achieving universal health coverage. The substantial number of people facing financial hardship reflects ongoing issues with healthcare financing, access, and affordability in our region. Many individuals and families struggle with the cost of medical services, medicines, and treatments, which can push them further into poverty and limit their access to essential healthcare. South Africa has made substantial strides in advancing UHC. Our national health insurance, which is currently being rolled out, represent a bold step towards providing comprehensive and affordable healthcare to all South Africans. It is based on the vision of an equitable healthcare system and serves all South Africans without causing financial strain. The NHI aims to eliminate financial barriers to health services and ensure that every citizen, regardless of income or geographical location, has access to quality healthcare. It is aimed at ensuring that individuals are not pushed into poverty or financial hardship due to out-of-pocket health expenses. It is designed to pool financial risk and redistribute resources to ensure that even the most vulnerable populations receive high quality care without direct costs at point of service. Madam Chair, I happened to have the privilege of being at the previous or the last BRICS Ministers of Health meeting, where this very meeting was discussed that the Russian chair has decided to actually act on. And for South Africa, we are hoping that some of the decisions that were made or taken at that meeting will be implemented. And these include BRICS Secretariat that it should establish a technical task force for planning of public health emergency operation centers among its countries with support from international partners and relevant stakeholders. That BRICS countries should establish channels for regular information and experiencing sharing. BRICS countries to organize joint training and exchange programs, workshops and exercises to enhance the skills and knowledge of personnel involved in the public health emergency operation centers. And these are just some of the decisions that were made at the last meeting that was held in South Africa in Durban in August last year. And with that, Madam Chair, in conclusion, I wish to reaffirm that South Africa's commitment to universal health coverage as a fundamental right and a cornerstone of our collective being. Together, we can build resilient health systems that serve everyone and ensure a healthier future for all. I thank you.
Thank you very much, South Africa. And I give the floor to Iran. I hope everything is well with connection. Please.
Sorry to have problem with the connection, so I changed my connection to my cell phone, so I cannot share with you the slides anymore, I'm afraid. So which slides did you see in my presentation, please?
You stop at proposal of collaboration.
Okay, the suggested topics, yes?
Yes.
Yeah, actually, so I will very briefly suggest some of the topics that we present for collaboration between the countries and the public health institutes. So it starts from combating burden of communicable and non-communicable diseases and strategies for doing that. Also research with regard to universal health system and universal health coverage in the BRICS countries, especially with regard to inequality and inequities, and also access to essential medicine. The other issues will be with regard to actually mental health and child health and maternal health, and also research with regard to nutrition and food security, health, antimicrobial resistance, also research in financing and payment systems with regard to urban health challenges, telemedicine, digital health, aging population and their needs, occupational health, adolescent health and well-being, and also with regard to climate change and health workforce. These are some types of research actually that are important issues in our country, and we think in countries, in the BRICS region. So we are happy for any mutual collaboration and joint projects and any types of close activities with the initiatives, in public health institutes and in BRICS countries, because one of the duty of the NIHR in Iran is to expand the collaboration with other countries, the international collaboration, both with South and with North countries. So we are very happy to share from our side and to get your experiences and to have some joint projects and collaboration in the future. Thank you very much for your attention.
Thank you very much. Okay, now we finished our panel, and I say thank you to all presenters, and we have seen that there is a lot of professional exchange among BRICS countries. The Russian Federation initiated one possible concrete way to move forward in this direction. The concept note that proposed establishing the BRICS Public Health Research Network was circulated before this meeting. Please allow us to present some initial propositions followed by contributions from all participants. Okay. Again, as we see, there is a great number of common interest and insightful practices to be shared across BRICS partner countries. At the technical and expert level, there is great potential for joint research in various areas. In this presentation, I would like to share the vision of joint work within BRICS Public Health Research Network. First of all, it should be noted that each of countries has unique expertise in the field of public health, including governance, epidemic control, the reduction of morbidity and mortality. Clearly, sharing this experience can help identify successful strategies and methods. Joint research could lead to the development of new methods for treatment and prevention of various diseases, including chronic diseases and infections. The Russian Federation proposed the initiative to create a standing expert platform to realize the joint aspiration of our countries. The BRICS Public Health Research Network envisions being a knowledge hub that offers equal and open access to the latest best practice in public health promotion and protection for all interested parties. The network has an ambitious goal to bring together and grow expertise in public health and digital transformation in healthcare to enhance the capacity of the BRICS member states to improve national health system. Sharing experience in health system governance can help countries improve and make their system more resilient to future threats. Healthy population contribute to economic growth. Joint efforts in health can help BRICS countries improve the well-being of their citizens. The network is supposed to bring together as network members the leading national expert organizations of BRICS countries working in the field of public health and digital health. The decision of the participation of national agencies in the networks of institutes should be made by ministers of health of the BRICS member states. A few words about the network structure. Network Secretariat is the permanent administrative arm tasked with the day-to-day management, coordination, interactions among members, organization, meeting, distribution information, and overseeing project execution. Its location and leadership might rotate among member states periodically to promote equitable engagement and responsibility sharing. Upon the steering committee's approval, specific working groups may be established to address principal public health challenges. These groups comprise of experts from the member states are tasked with the technical execution of the network, including conducting research, managing projects, and analyzing data. Working groups are expected to provide regular updates to the steering committee. Finally, the annual update on the network activity should be provided to the respective ministers for the annual meeting of the BRICS Ministers of Health. I would like to note that it's proposed to create an expert platform based on the principles of consensus and scientific justification. All decisions will be made during expert discussions. Voting on scientific issues is not expected. In conclusion, I would like to emphasize that certainly joint efforts in public health will help strengthen diplomatic relations between our countries, which in turn can lead to other types of cooperation. Successful joint research and projects can attract investments in public health from other countries and organizations. Undoubtedly, the exchange of experience and agreements reached during the discussions will contribute to the improvement of public health system worldwide. Okay, thank you, dear colleagues. We now open the floor for discussion. I encourage all participants to share their thoughts and proposal ideas for collaboration. Please feel free and raise your hand, and I will call on you in order. And with my pleasure, I will pass the floor to my colleague, Dr. Alexey Novozhilov, to operate this session. Alexey, please.
Thank you. I hope everybody can hear me, and I'm proud to moderate this general discussion session. And in order to organize our discussion and to avoid any misunderstanding and to avoid the mess and to order our discussion. I would like to propose the way forward. As we don't have any opportunity, technical opportunity on the platform we are working on now to raise the hands, as was mentioned by Chair, I would like to propose to use our chat. And if you wish to speak, please put the exclamation mark in the chat, and I will call you one by one. If you wish to speak on regarding the network proposed by the Russian Federation to be established. We have heard many supportive words during the general presentations, but now we are coming to the general debate, general discussion, and we are ready to hear and discuss with you the ideas how to better improve this network, how to pose it in a position which will work for all of us. And before I'm waiting for as I'm waiting for the first exclamation mark in the chart, I know I requested by our colleagues from the uh, Bricks Civil Forum Working Group called Public Health and People's Well-Being. Raul Ernestovich, please, floor is yours for your intervention.
Thank you very much for the introduction, and thank you for giving a word for us. Our group of actually have a meeting in Moscow in July this year, and it was this Bricks Civil Forum, and we have a group which is called the Public Health and Human Well-Being, and several participants. We have many participants from the group from each Bricks countries, and we actually highlighted and agreed upon several key issues related to public health and human well-being, and we would like to share with you because we think that this can be important. Our ideas can be important, and you can use them for the work which you are doing here and for all the future aspirations. And before explaining some key points, I would like to say thank you from our group. We have our working group secretary Irina Tokareva and also Konstantin Kunz. He is the active member of our group, and we have two co-chairs. One co-chair is Natalia Bondarenko, who is the chief physician of the Clinical Hospital 85 of Russian Medical and Biological Agency and head specialist in general medicine of that agency, and also Mr. Pir Hossein Kolivan, who is the president of Red Cross and Red Crescent Society of Islamic Republic of Iran. And the points which we highlighted and agreed upon during our work and preparation for the Bricks Civil Forum is that we understand and appreciate the cultural uniqueness of each nation of all Bricks countries, and we understand and advocate for that each person in every BRIC country should have timely access to effective healthcare services and medical drugs, despite their social status, nationality, religious and political beliefs, age, and gender. And we highlight the importance of social justice principles in healthcare and public health services. We highlight that there is a huge opportunity for mutual collaboration between all BRICS countries and share our unique experiences, which will be of value for nations health in every BRICS country. We believe in importance of health literacy education as a part of public health initiatives. And another interesting area is an exchange of experience between our countries in the area of standardization in safety and healthcare and quality of healthcare services and person-centeredness of healthcare services. And we also believe and agreed upon and advocate that we should stand for traditional family values of our countries, which is the basis for sustainable future development. And related to this point is the importance of comprehensive physical and intellectual and spiritual development of young generations of our countries. And the last point is that we should advocate for addressing the problem of drugs abuse and join our efforts in this area, which is hugely important for the future generations of our countries. And we believe that it's important to maintain the dialogue between public health agencies, research institutes, government, and civil societies in our countries, which with the aim to improve public health services and well-being of people in our countries. And thank you once again for having an opportunity to participate in this meeting. And that's it from us.
Thank you. Thank you very much for your comprehensive work and your comprehensive presentation of the work which you're doing by the civil society organization around the BRICS community. It's very proud to have the professionals around us as well. I don't see any exclamation mark in the chat. I hope that everybody knows where the chart is. If not, it's in your left side, the bottom, the chat. You could open the chat and raise your hand or exclamation mark if you wish to speak. Let's wait few minutes, few seconds more if somebody will raise the willingness to speak.
Alexei, our colleague from Iran would like to tell, yeah?
If yes, I don't see any. Yeah, sorry,
Yeah. Can you hear me?
Yes, exactly. Please.
Okay, with your permission, thank you for the proposal that you suggested. I think it's very comprehensive and to the point, and we are very happy with that. Generally, I would like to add some comments on the top of that. The first one is I think we should focus more on expanding the capacities and the capacities that will help us to share the experiences and to learn lessons from each other. Especially, we are in a very diverse sort of countries. We have a lot of diversities, but we also have a lot in common. For example, some of the countries face the unilateral sanctions, and these sanctions might affect the health of population and suffering from that. And there are other both man-made disasters and natural disasters and wars and unrest. So I think it's good that we also consider some of these issues that we have in common and to make some capacities for sharing experiences like forums, as you mentioned, and networks. And maybe one suggestion will be somehow funding, joint funding of the projects. For example, in NIMAD, that is a sort of granting body in Iran Ministry of Health, they do some types of grant for multi-country collaborations. For example, they say if you add two other public health institutes from two other countries, so they will promote granting this project. If we can somehow try to have some share grants and funds for share projects, I think it's somehow, I'm talking somehow about the institutionalization of the collaboration and the network and the joint programs and project. And I think we should add some comments, with regard to these issues. Thank you.
Yes, thank you very much. It's very timely proposal to conduct joint research and to try to share our grants for the research. Exactly, we will do it in the future when we will discuss the concrete proposal and we will
Dear colleagues, somebody else? Okay, there is a question in our chat. Just a minute.
Hello, can I have a word?
Sure, please.
So I would like to know if the BRICS, if this network, the BRICS Public Health Research Network will maintain dialogue with other BRICS networks like BRICS TB network and the BRICS calls managed by the science and technology ministers.
Okay, and the same question in the chat, yeah? Yes,
Yeah.
from you. The answer is, of course, yes. We will communicate and exchange information, data, experience with other network. Of course, yes.
Thank you.
Okay, dear colleagues, in this way, we will now begin drafting the meeting report summarizing the key takeaways and agreed upon next steps. This document will guide our future work and collaboration. I invite all participants to contribute any final remarks or suggestions for inclusion in this report. But before this, I give the floor to India. Please, India.
Yeah, thank you so much for this opportunity and the proposal of the Russian Federation to have this research network. Looking at the earlier networks, I think we have other research networks which have been proposed, like there is a tuberculosis research network. There is also a vaccine research and development center. So this also is a public health research network, what has been proposed. Now, by adding the word research, we feel that it would limit the scope of the network. So the proposal is to have the public health institutes network. Of course, the research would be a subcomponent under that. Thank you.
Thank you very much, India. We got it and take it into account. Thank you very much. Okay, just a minute. Okay, and there is a question about financing of our gathering work into our network. The answer is nowadays every country finances this work in a current finance. And in the future, we can look and seek information about grants. I think so. Now there is no additional financing. One more question, just a minute.
Yes, please. I have a question. Is it possible to do that?
Sure.
The question is, my colleague Cláudia Roerich from Brazil asked, but I think the reply, the answer was not complete. She mentioned the question of the network of tuberculosis research. Tuberculosis, it's a very important problem in many countries. But there are other questions that the Ministry of Science and Technology are proposing, calling for research in medical and public health issues, medical and public health questions, like many we have been accessing this call for research, which will be the relations between our network with this call for research in medical issues, in public health issues, that is being made by the Ministry of Science and Technology. This is my question. Because the risk we have is to fractionate, to have to broken and non-integrate groups of research that have been constituting in other sector called science and technology, and which relation will be with the working groups we are proposing in terms of research in some special issues of public health or medicine, please. Thanks so much.
Thank you. Alexei, please.
Yes, thank you. Thank you. If you allow me just to react to the Brazilian proposal and questions concerning the networking with other networks, I would call it like this. Exactly, it will be needed, but our working group, in my understanding, the working group of this network will be aimed to avoid overlapping with other networks. Because if TB network, TB BRICS network is working on some research on TB prevention, exactly some our experts could propose to establish the same group, the same working group with the same aim within our network, but we will try to avoid such overlapping, but we will propose our solutions to the TB network, for example, to strengthen the efforts on this area. This is my vision. Please do not hesitate to criticize me on this, but it's simply my vision. Concerning the outcome document, which we are going to talk now, it's not our obligations to produce some report exactly, but to be in line with the formalities in our understanding, it will be important to report back to our ministers that we met, we discussed this topic, and we agreed to establish the network, and we need support from our ministers to formally decide about it. As we know, next month or months after, our minister will meet in Russia before the high-level summit of the head of states and governments of our countries, and they will discuss many topics. Within these topics should be our topic indicated, and to reach this goal, we think that we will need to send back to our ministries some paper mentioning that we met, we discussed it, and we agreed to, and we are asking to establish this network. That's why we prepared this draft report. It's very simple paper saying simply that we met September 12th, we discussed this and this and this, and the last para is most important in this document, in my understanding, that as a follow-up of the meeting, we will inform our respective Minister of Health about our result and ask them to support the establishment of the BRICS Public Health Research Network during the forthcoming BRICS Minister of Health meeting. It's concerning this part.
Okay, Alexei, there is one more question from Egypt, please. Egypt.
We
Just a minute, colleague.
yes, we see the question in the chat about the composition of the steering committee.
Absolutely.
Uh, in my understanding, when our minister will decide to establish the network during the first network meeting, because now we are in the BRICS exhibition meeting, it's not a network meeting. It's a first step to establish, to discuss the establishment. When our minister will decide to establish, and we will formally invite you to the first network meeting, we will prepare the the, the number of some modalities for the steering committee, for the working group establishment, some modus operandi for the network, and exactly we will discuss in details how it should work.
Thank you. There is no question in our chat, and I think we can continue. Yes? Alexei, and several words about our drafting, please.
Yes, colleagues, the draft shown on the screen, you have received it before the meeting, and if you had an opportunity to revise it, and if you have any comments, any additions to this draft, please raise your hand and say us what you wish to add or change in this report. If oh, sorry, one more question from Iran, I think. What specific leadership qualities and expertise do you believe are essential for guiding this international research network towards achieving its strategic goals and ensuring long-term sustainability? Good question.
Colleague, just a minute. Okay. The question was about expertise of institute of organization who can be in network. My opinion is that this decision take National Healthcare Ministry. I think so, and they will decide which organization institute will be in network. I think so. Alexei, that's all. Continue, please.
Yeah, thank you. Let's come back to the draft report. If you don't have any additions, could we take it as your agreement with the draft report, and could we send it back to our ministry, and will you do the same with your ministries?
Sorry, Chair. I'm having a problem with the system, so I'm not able to put the exclamation mark you asked for. This is
Yeah.
South Africa, and I am told by my health colleagues that South Africa is comfortable with the draft from the chair, so we are ready to support. Thank you.
Thank you very much, South Africa, for your support. Yes, thank you. It means that you agrees with the text proposed. Any other concerns? Any other additions, comments on this regard? I see no.
Yes, I would like to receive the draft report. Thanks for this effort, and it will be interesting if we have 2 or 3 days to suggest some. I have a concern regarding the several initiatives in BRICS led by different institutions with issues in health research. and we should try to get to be explicit in our draft report the relationship between this network on public health research and other initiatives in health research we have under the umbrella of BRICS. I think this is very, very important, and because if you can imagine many initiatives without a link between them or among them, and this can be not, we can lose efforts, eventually lose resources that are very, very difficult budgets, the national budgets. So I would like to ask for 2 or 3 days next week to examine how we can contribute with this perspective, how to put together the pre-existing initiatives in public health research, in health issues research, to get more effectivity, more rationality in the field of health research under the umbrella of BRICS. Please, I would like to hear your comments about this one.
Okay, thank you very much, dear colleague. We got your proposal, and I think we can give a time till, for instance, the 20th of September. It's enough time for thinking. Thank you.
Yes, thank you. Yes, if I'm not mistaken, I've heard that you don't have this draft report on your hands. You just see it the first time. Is it correct? Okay. If
I
some,
know the excellent conceptual note you send us, and this draft report is, for sure, I understand, is taking the sketch of the main messages you put in the conceptual note. It's quite good, but I'm concerned with these connections under the umbrella of BRICS on health research, and my group, my assistant can put in a letter for you, and in the draft report eventually mention of these other initiatives of health research in BRICS, and how we can link our initiative, the very nice initiative of experts meeting on public health, with other initiatives in health research that is existing in BRICS. Exactly the main example, or the best example, is the network of tuberculosis.
Okay, got it. Thank you very much. So, dear colleagues, is there questions? Anything else to add? Okay, in this way, before we conclude, allow me to present a brief summary or about today's key points. I think it's a common opinion that the first BRICS expert meetings on public health has been a success. This gathering has not only fostered valuable dialogue on public health research, but also laid the foundation for enhancing the well-being of citizens across the BRICS countries. Four most important points. The first one, we have heard insightful presentation from each BRICS member state highlighting their public health initiatives, challenges, and propositions for future collaborations. These sharings of experiences will undoubtedly strengthen our cooperative efforts. Second one, through today's discussion, we have identified potential areas for joint research, and we will think about it before the 20th of September, of course. Today, we have formally supported the establishment of this network. It will serve as a crucial platform for joint research, knowledge exchange, and addressing common public health challenges. And the last one about next steps. Finally, we will draft a report outlining the next step, which include formalizing the Bricks Public Health Research Network and setting future direction for cooperation within the next weeks, a couple of weeks. And we send draft for all participants of today meetings, of course. Sorry us for miss it. Okay, at the end of our meeting, I am happy to say thank you all of you, because I think it was a very important meeting, and we exchange information, exchange our thoughts, and it's a start of a huge, important, great work. Would somebody else like to say something? Everybody tied. I think so. But there is a question. 1 minute. Okay. Okay, colleague, we received the question, or maybe not even question, but opinion, that before exchange best practices, it's important to receive a study with tech characteristic of health system of each country. Totally agree, and all of us, all of our country are different. We have different healthcare systems, and moreover, even into one country so huge as Russia, we have 89 regions, and all these regions have some features in healthcare system. Of course, yes, we support this idea. Okay, so at the end of our meeting, thank you to all of our participants. This concludes the first BRICS expert meeting on public health. We look forward to continue our work together. Thank you very much for your time, for your patience, and for your expertise. Thank you, and have a good evening, night, or day. Bye.